Hi, I'm Barton Haynes, Director of the Duke Human Vaccine Institute. The mission of the Institute is to develop drugs and vaccines to protect society from infectious disease threats, as well as from other non-infectious diseases in which the immune system may cause damage to the body. For the past 14 years, I've led the NIH-funded Center for HIV/AIDS Vaccine Immunology, or CHAVI, to develop a vaccine for HIV. From 1985, when I first started working on an AIDS vaccine, until 2005, when the first CHAVI grant was funded, the HIV vaccine field worked to make an HIV vaccine based upon all the existing vaccines for viral diseases that were approved at the time, such as measles, mumps, rubella, and polio. Yet none of these HIV vaccine candidates worked. Then in 2005, the National Institutes of Health and the Bill and Melinda Gates Foundation got together and decided to fund HIV vaccine research a different way. That is, to fund big science in groups of investigators to try to make greater progress. In the first CHAVI grant from 2005 to 2012, we figured out what the problems were and began to understand why all the previous work had failed. For one trial that worked partially, we led the team that found out why it had partially worked. For making a broadly protective vaccine that would work for all people, we found that antibodies that can neutralize or kill the virus, that are called broadly neutralizing antibodies, are disfavored by the body, and the body does not routinely make these types of antibodies. From 2012 to 2019, in the second NIH CHAVI grant, we defined new strategies for solving the problem and worked out a plan for moving forward to make a vaccine that would induce the right immune responses to protect against HIV. This strategy involved developing new techniques for guiding the body's immune system to make the desired broadly protective antibodies. Then in the third NIH grant, just funded to the Institute in 2019 for the next 7 years, we're now to take what we have learned in the past years and actually make the vaccine for testing in humans. We hope to end this grant with a broadly protective HIV vaccine design that can be used globally. To do this, we've had to build our own vaccine production facility here at Duke that we're now using to make our vaccine candidates. And these vaccines are being tested in humans for their ability to induce the right kind of immune responses. In addition to AIDS, the Institute has a program for developing a universal influenza vaccine. A universal flu vaccine could be taken once and then be expected to protect us for years instead of having to have a yearly booster for the particular strain of influenza that might be circulating. In addition, the Institute has a program for development of a vaccine for cytomegalovirus, or CMV. CMV is an infection acquired at birth that can affect newborns with devastating results. A CMV vaccine would be used to protect babies born to mothers with CMV. In addition to working on HIV, influenza, and CMV vaccines, the Duke Human Vaccine Institute has as our mission to also respond to any viral or bacterial pandemic that arises that might threaten society. To this end, the Institute has programs to develop vaccines and other countermeasures that can be applied to virtually any new or re-emerging infectious agents that may strike. Looking to the future, the Institute is leading a new initiative called Engineering the Immune System that is targeted to learning the specific rules of how the immune system works so we can develop safe ways to increase or decrease immunity as needed, to achieve or maintain health, and to keep the immune system in control so as to avoid damage to the body, such as occurs in cancer, brain degeneration, heart disease, or autoimmune diseases. Finally, the Duke Human Vaccine Institute is committed to working on behalf of society to develop and to make available needed vaccines and drugs for difficult to prevent or difficult to treat conditions. We believe that doing this in the academic setting at Duke is a powerful platform for success, and once products are developed, then we'll hand them off to industry with guidelines that they must be made available to those that need them at reasonable cost. We believe that the mission of the Institute is an important mission for Duke University, and we hope that you'll join us in supporting us as we work for the health of society.